What is universal healthcare? Now, there are many terms that politicians have used as buzzwords to push their own ideologies. And in doing so, they've caused the public to have very skewed definitions of what these terms actually mean. Because I know you're going to ask, this video is not to push an opinion on you. The point of this video is so that when you go to form your own opinion, you have a more accurate understanding of the terms. So let's get started. Hold on, my big old head's in the way. That's better. Okay, universal healthcare means that all people have access to healthcare services when they need them without financial hardship. That's it. So there are many different ways that you can provide universal healthcare to people. And the first one that I'm going to talk about is socialized medicine. Now, socialized medicine is government-owned and operated healthcare. So the government owns the healthcare system. This term is the term that often gets confused for universal healthcare. People often interchange the two terms when in fact they're kind of different. So universal healthcare, again, is the overarching term to say that we want people to be able to access healthcare regardless of financial status. Socialized medicine is just one of many ways to achieve that. A good example of socialized medicine in the United States would be like the VA for veterans. The VA facilities are typically government owned, and the healthcare workers who work in those facilities are usually government employees. Another way you can achieve universal healthcare is through the single payer system. So in this system, the government does not own and operate the healthcare facilities. They simply reimburse or pay for a patient's care. This is exactly like our Medicare system that we have now. So Medicare is not running the hospital, they're simply paying the bill when one of their patients goes in. So the last one I'm going to talk about is private insurance. So some countries put regulations in place that require all their citizens to purchase private insurance. And as long as that insurance is affordable to every demographic and that patients can access the care that they need, they can achieve universal health care. Now, we really don't have a great example of this in the United States, but it was kind of attempted with the Affordable Care Act, where we were all mandated to have insurance, and then some of those costs were tiered based on income. But there were a lot of demographics that fell through the cracks, so this wasn't true universal coverage. Another thing to keep in mind is that you don't have to subscribe to one single method to achieve universal health care. In fact, most other countries have various combinations of all these methods to make sure that all their citizens are covered.